Hello and good morning, everyone. My today's talk is about understanding osteoporosis, prevention, diagnosis, and treatment. Today, I am going to talk about a very important but often silent condition called osteoporosis. Osteoporosis literally means porous bone. It is a condition where bone becomes weak and fragile, increasing the risk of fracture, especially in the hip, spine, and wrist. Hip fracture can be life and limb threatening sometimes. So, what is osteoporosis? Bone is a living tissue throughout life. It is constantly being broken down and rebuilt. When we are young, bone formation is faster than bone loss. However, as we age, especially after the age of 50, this balance changes. In osteoporosis, the bone loss exceeds bone formation, leading to reduced bone density and structural deterioration. Why this is important? Osteoporosis is often called a silent disease because there are no symptoms until a fracture occurs. The common fractures include hip fracture, vertebral fracture, or wrist fractures. A hip fracture is particularly can significantly affect independence and quality of life. Sometimes it can be life threatening. Now, who are the patients at risk? And not only patients, who are the people at risk? Some common risk factors include increasing age, female gender, especially after menopause, family history of fractures, low body weight, smoking and alcohol has an important role to play. Lack of physical activities is very vital, and long term steroid use for any medical condition. Men are also affected, but is much more common in females. So, what are the symptoms? As I said, it's a silent disease. Most people have no symptoms until a fracture occurs. However, the warning signs include loss of weight, back pain, stooped posture. Spine should be straight, but if you start bending, you are reducing your height significantly. Check with your doctor. Now, how to know that you suffer from osteoporosis? Unfortunately, unless you do a test, it's very difficult to detect. The most important test these days is DEXA scan, that is called bone density scan. It gives three types of a score, and most important is the T score. If it is above -1, that's normal. If it is between -1 to -2.5, means you are having osteopenia. I will talk about osteopenia at some stage. In this one, bone becomes thin out, but it's not as bad where you call it osteoporosis. And if the T score is below -2.5, we call this osteoporosis. Other investigations may include blood tests, including calcium, vitamin D, thyroid functions, and screening for secondary causes. Whenever somebody is detected as having osteoporosis, it's good to check with your doctor. Is there any medical condition which can lead to osteoporosis? For example, low vitamin D, hypothyroidism, or any medical conditions for which you take steroid. Now, how to treat this condition? Treatment has three main components. The first and very important factor is lifestyle measures. Regular weight bearing exercises, including walking, strength training, adequate calcium intake, vitamin D supplementation, and fall prevention strategies are important. You should get your vitamin D level checked by your doctor on a yearly basis, and ideally, you should have thyroid function tests as well. The common medications include alendronate, risodronate, denosumab, teriparatide, and out of which alendronate is the gold standard. These medications work by either reducing the bone breakdown or increasing the bone formation. Monitoring is important. You should have your DEXA scan done every 2 to 3 years and make sure that your bone mass is maintained. And also, one need to get checked that you don't have any side effects of any medications if you are having. Now I'm going to talk something about osteoporosis, which is more related to general practitioners. We use tools like FRAX, F-R-A-X, to estimate 10 years fracture risk. In that one, we consider secondary causes like endocrine disorder, chronic kidney disease, malabsorption. All these conditions can lead to osteoporosis. And the treatment is tailored based on fracture risk, age, and comorbidities. But one also has to be careful about atypical femoral fractures and osteonecrosis of the jaw. So, ladies and gentlemen, my final thoughts are that osteoporosis is a preventable but treatable condition. It is a silent disease. You don't want to have fracture, then diagnosed to have osteoporosis. Early detection, healthy lifestyle, and appropriate medication can significantly reduce the fracture risk and improve the quality of life. And finally, if you are above 50 or have the risk factors as I discussed above, please discuss bone health with your own doctor. And remember, prevention is always better than fracture. Thank you very much for listening. Have a good day, guys.